You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Hi, Dr. Martin here this morning, and want to talk to you about seven signs that possibly you're low in vitamin D. A lot of people have no idea because most times it's very difficult to find out exactly where your vitamin D levels are. And vitamin D levels need to be optimized, and so unless you really get a blood test done to know what what they call the blood test is called dihydroxy-25. And so you don't know if you're low in vitamin D really unless you get a blood test done. But here are possible signs that you're low in vitamin D. First of all, if you live anywhere where you cannot be outside with a t-shirt on or short sleeve and shorts, you're probably going to be low in vitamin D unless you're supplementing with vitamin D, okay? So if you live in Canada, northern United States or whatever, like you got low vitamin D unless you're supplementing with vitamin D, and that's why we recommend supplementing, okay? But let me just go through some possible signs that you are low in vitamin D, and some of these are surprising. The number one sign, of course, is if you're frequently ill, especially with flus and colds, and you get frequent colds and infections or whatever, your immune system isn't right. Well, that usually is a sign that you're low in vitamin D. So vitamin D is essential for the immune system. We can't talk about that enough. If you in the news today is about the coronavirus, and you know what? In the Philippines and whatever, there's no coronavirus. It's hot. And humidity and the sun get rid of the flu bugs and the coronavirus and all these type of things. So this is really important. Vitamin D, one sign, if your immune system isn't up to snuff, you are probably low in vitamin D. Now, secondly, depression. This is so common, it's unbelievable, but especially with seasonal depression, if you find the winter months, you get the winter blues, especially in those dark months, January, February, and March, or December, February, January, and February, those are your real dark months. And if you find yourself in the blues, depression, seasonal, any depression can be low in vitamin D. Seasonal depression is guaranteed to be low in vitamin D. If you are not supplementing with vitamin D and you have digestive issues, Crohn's, IBS, celiac, diverticulosis, SIBO, H. pylori, if you have any of those conditions, you are probably low in vitamin D if you're not supplementing, because vitamin D is a fat-soluble vitamin, needs to be absorbed in the gut. So this is a very important thing, that vitamin D, and this is why we love probiotics, because probiotics help to absorb your vitamin D. And so, if your gut's not right, you're probably low in vitamin D. We talk a lot about that in B12 too, right? B12 is a finicky vitamin, and it is very hard vitamin at the best of times to absorb. So if you got any kind of digestive issues, you need to be supplementing with probiotic even to get your vitamin D levels up. If you have sore muscles and muscle weakness, this is often a sign that your vitamin D levels are not optimized. Just sore for no reason. A lot of people have fibromyalgia. They call it fibromyalgia. And yeah, it could be fibromyalgia, but oftentimes when we check them, their vitamin D levels are extremely low. So just even bone pain, I'm aching in my bones. this can be a sign that your vitamin D levels are low. Let me just give you a couple of more. Lungs. Lungs don't work properly without vitamin D. So if you have COPD, if you have any kind of, maybe you got damaged lungs of asthma and damaged lungs from chemicals or whatever in the workplace or whatever this is, almost invariably you have low levels of vitamin D. Vitamin D is essential for your lung function. High blood pressure. Yeah, isn't that amazing? Because we often talk about magnesium, relax, magnesium helps with blood pressure, but so does vitamin D. If you're low in vitamin D, it can be a factor in high blood pressure. So these things are really significant when you think about it, right? So make sure you're taking, again, into the club. I'll tell you what I'm taking. I take between I'm in Florida right now, so I need less, but 8,000. In the dark months, I'll often take 12,000 IUs daily of vitamin D. In those December, January, February, of course, we're past that now. You have a little bit more sunlight, especially with daylight saving time. It actually helps with your vitamin D levels as the day expands. So these are just things that I wanted to talk to you about this morning. The sun, vitamin D, is nature's natural vaccine. It really is. It's nature's natural vaccine for cancer, for the flu, and for the cold. And this is vitamin D. I talk about it all the time. It's an essential vitamin. So if you have any of those symptoms, consider possibly that you are low in your vitamin D levels, okay? So we'll talk to you soon. We'll do some more teaching. Talk to you guys soon.
You've reached the end of another Dr. is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.